Welcome back to the East Meets West podcast on health and medicine. This is the podcast where we talk about health and disease from both a Western allopathic perspective as well as an Eastern Chinese medicine perspective. I'm your host, Dr. David Cherian. I am a licensed acupuncturist practicing Chinese medicine, as well as a board certified family medicine physician in Houston, Texas. And every episode here, we look at different diseases and how both Eastern and Western medicine work in complementary ways to help you achieve the best health and best outcomes. So, today on the podcast, we are going to talk about endometriosis. Endometriosis, what it is, how it affects people, and what the treatment options are from both a Western traditional allopathic perspective as well as the Chinese medicine perspective. So let's talk a little bit about endometriosis. And this can be a difficult disease to understand. So I'm going to try to spend a minute just trying to simplify it. Now, endometriosis is related to the endometrial lining. And what that is in the uterus, there is a inner lining, which is composed of a type of tissue called endometrium. And this is a special type of layer that's made out of glands that produce secretions during the menstrual cycle. And during the cycle, they progressively get larger. And then when the progesterone levels come down, they start to decrease in size and degenerate and slough off, which is where the bleeding of the menstrual phase comes from. And that is all a normal part of how the menstrual cycle works. Now, in endometriosis, that's when you have that same endometrial tissue that is supposed to be within the uterus, and it happens outside of the uterus. When you find those endometrial glands that are going through that whole process of growing, secreting, breaking down, sloughing off, and when you find that happening, when you find those tissue outside of the uterus, that's endometriosis. So it can happen in a lot of different places outside of the uterus. But the most important thing is that it is outside of the uterus. That's what defines endometriosis. So the most common place where we find endometriosis outside of the uterus is the ovaries, which is about 2/3 of the time. But it can go to other areas like the bladder, the fallopian tubes, the vagina. Typically, it's within the pelvic area, but in rare cases, it can occur outside of the pelvic area as well. We don't really understand how endometriosis develops. There's a lot of different theories out there, but none of them have been able to explain all of the different findings. And it's still an active area of investigation. It's still actively being researched in science. So we don't know the complete answer as to the why of endometriosis. So what do people feel when they have endometriosis? Well, it's usually diagnosed because of a few specific symptoms that it can cause. Endometriosis can cause painful cycles. It can cause painful sexual intercourse. It can cause chronic pelvic pain. And it can also be implicated in infertility. And it's usually when a woman has one of those symptoms that will cause her to seek out evaluation for it, and that's when endometriosis is then diagnosed. Now, specifically for endometriosis and fertility, the data shows that endometriosis can cause infertility anywhere, and women who present with infertility, anywhere from a quarter to half of the time, there may be endometriosis present. So it's something that's very common and it does negatively impact fertility. Now, let's talk a little bit about diagnosis. How do you diagnose endometriosis? We know what some of the symptoms are, but then how do we go from there to actually knowing that you have endometriosis, or that is what the diagnosis is? And one of the challenges of endometriosis is that it can be difficult to diagnose. There's not any great blood tests for it. There are imaging tests like ultrasound and MRI, which can give some clues and they can suggest it, but not definitive in diagnosing it. The hard part of endometriosis is that when it comes to diagnosis, the only definitive way to really diagnose endometriosis is by surgically going in, visualizing it, and taking biopsies. And so what that means is that a lot of times to definitively diagnose it, you have to go through an operation. And so not everyone who is suspected of having endometriosis will go through that entire complete process, including surgery, to get definitively diagnosed. And that leaves a lot of gray area for patients and doctors to decide how far that you want to go to get that definitive diagnosis. And a big part of it depends on how much of a problem it may be causing you personally. If you're having mild symptoms that does not really affect your life significantly and you're able to manage it, then chances are your doctor is not going to recommend you to go through a surgery to try and diagnose it. But if it is something that is causing you a lot more problems, or very severe, or not responding to medication, or maybe part of infertility, then it may be worth doing and something your doctor might recommend for you. Let's talk a little bit about management in terms of symptoms. And we can start with talking about pain symptoms because, again, that's one of the most common reasons that people find that they have endometriosis. It's because of the pain that it was causing. One of the common reasons that women will seek treatment for endometriosis is because of the pain. And like I said earlier, throughout the menstrual cycle, as those endometrial glands grow and produce those secretions in parts of the body they're not supposed to, they can cause pain symptoms. And typically, doctors are going to recommend non-steroidal anti-inflammatory drugs as the first place to start. So common medications like ibuprofen or Motrin or naproxen, those are medications that they're going to recommend that you start with. And if you're not planning on becoming pregnant, your doctor may prescribe you birth control pills as well. And that helps to reduce the pain that's associated with endometriosis. Those are usually the first couple of things that doctors will try to help treat pain associated with endometriosis. Now, beyond that, there is another class of medications that are used that are gonadotropin releasing hormone medications. And these medications act more centrally on centrally mediated hormones that originate from your pituitary gland. And I'm not going to go into a lot of details about the different types of treatment options here, but one of the common used medications is leuprolide. Typically, these medications have been shown to be more helpful for more severe symptoms that are not improving with just non-steroidal anti-inflammatories or birth control pills. The last class of medications that I'm going to briefly touch on are the aromatase inhibitors. And these medications are reserved for more severe refractory pain that's not responding to the other medications. And we did actually talk about some of these medications in another episode. And these class of medications include medicines like anastrozole or letrozole. And these class of medications are actually more commonly used for another indication, which is breast cancer. And what these medications do is they prevent conversion of hormones into estrogen. And so they inhibit estrogen production in the ovaries and the brain and other areas. Now, they do have a number of side effects, including losing your bone density. They can cause osteoporosis and lots of other side effects. And it's not a medicine that you want to try as your first option. It's more reserved for later options. In addition to those, there's other types of pain medicines like neuropathic pain medicines, gabapentin that your doctor may try for you. Now, let's say that beyond those medication options, you want to consider other options. And when we get past medication options, the next thing to consider are surgical options. But like other areas of medicine, we try to reserve surgery for specific situations because of associated risks with surgery. And one of the principles about treatment with endometriosis is that from a Western medicine perspective, the goal is to try and minimize the number of times a woman will have to go through surgery. And we try to minimize it primarily by using medications to the maximum that we need to. So again, the big picture goal from a Western medicine perspective is to really try and limit doing surgery, limit the number of times a woman has to go through surgery. Okay. Now, there are a few scenarios when surgery is considered. And some of those scenarios are as if a woman has persistent pain that is severe despite medication treatment. Another scenario is when the diagnosis of endometriosis is in question and a biopsy may be needed to verify the diagnosis. Sometimes there may be a concern of cancer versus endometriosis, and again, you need to go in and verify that diagnosis. Another indication is when endometriosis is severe to the point where it's interfering with bowel movements or ability to urinate. That is also considered a reason to proceed with surgery. Studies have shown that women with more extensive endometriosis do have improved pain relief from surgery. And there are a lot of benefits to the surgical procedure. And one of the main ones is that the fact that endometriosis can be visually and confirmed with biopsy, as well as evaluating the extent of it. And another benefit is that the surgeon can excise or perform ablation right then and there on areas of endometriosis and potentially treat it right then and there. Those are some of the benefits. The disadvantages of surgery are there can be a risk of injury, especially to the intestines or the bladder. Surgery could reduce the ovarian reserve, which could reduce your fertility if surgery is performed in the ovaries. There's risks of adhesion, which can happen with any intra-abdominal surgery. And so there are a lot of factors to consider when it comes to surgical treatment. for endometriosis. So that's a little bit about endometriosis from a Western perspective. Let's talk about it from a Chinese medicine perspective. In Chinese medicine, endometriosis is closely related to the Qigong and Ren meridians. And it's thought in Chinese medicine that endometriosis is caused by what we call blood stasis. Chinese medicine is effective at treating pain symptoms associated with endometriosis. It's effective at treating anemia, and it's also helpful for infertility and improving quality of life for patients. And even patients who may have had their symptoms already improved, it's still good to use Chinese medicine to help regulate the body, to help regulate the yin and the yang energy, to help regulate the qi and the blood, to help prevent recurrence or complications or worsening of endometriosis. Now, I said that blood stasis is one of the common causes of endometriosis from a Chinese medicine standpoint, and specifically in the Chong and Ren meridian. And there are a lot of underlying factors that can lead to this. So, one example is stress, emotional stressors, whether it's unresolved anger or frustration or long-term stress from personal or work life. Those kinds of things that we may not associate in Western medicine plays a big part in Chinese medicine. And in Chinese medicine, it can be thought to impair the flow of qi in the liver, the flow of blood, and especially in the liver, when the qi of the liver doesn't flow, it causes blood stasis because the qi is what's responsible for regulating the movement of the entire body's qi. And so that's really crucial to having good blood flow in the Chong and the Ren meridians. Another common cause from a Chinese medicine perspective is overwork. And when you overwork yourself, it consumes your kidney qi. And kidney qi is also another important factor of having good blood and qi movement and supply in the uterus. And so all of these things may start up as small problems, but if you leave it unchecked over time, it can continue to progress and cause more serious symptoms and serious disease such as endometriosis. So in Chinese medicine, our goal is to really even identify some of the pre-factors that we can take care of at an early stage and help prevent it from progressing. And to get in a little more into the detail, there's 4 broad categories that the majority of patients with endometriosis have some component of. It's going to vary from patient to patient and into the degree of each of these, but typically patients will have one of these broad categories to some degree. I already mentioned one of them, which was liver qi stagnation. And then you can also have a few different other common conditions, such as cold in the blood causing blood stasis, or heat in the blood causing blood stasis. Another one that's also especially common here in Houston is what we call dampness in the body. And that can also cause blood stasis and cause endometriosis. Those are 4 broad categories. And just to give an example of one of the treatments that we would do in terms of an herbal treatment, there is a classic Chinese medicine formula called Shao Fu Zuyu Tang. And that's one example. There's numerous types of formulas, but this formula is specifically intended to drive out blood stasis. In fact, the name of the formula means drive out blood stasis decoction. And Each patient is going to be different. Every patient has a different type. Every patient has a different constitution. And in every patient, we always try to take an individualized approach at our clinic and really try to delineate what your imbalance is, to what extent is that imbalance causing, are there any complications from it? And so from person to person, the treatment will always vary, either a small amount or to a very large amount. And that's why it's important to have a doctor who will spend that time to give you the personalized approach and to really understand what are the underlying factors that may be causing you to have endometriosis. And this formula, Shaofutsu Yu Tang, was derived in the early 1800s, and it combines herbs that nourish the blood, and it also warms the uterus. It includes herbs like ginger and cinnamon, which are warming type medicines in Chinese medicine, and that can also help to promote movement and blood movement in the uterus. So, to finish up for today, we've talked about endometriosis, what it is, some of the treatment options for it from a Western medicine perspective. We've talked about over-the-counter options like non-steroidal anti-inflammatories. We've also talked about additional medication options like birth control pills or the GnRH modifying medications or aromatase inhibitors. We talked about surgical options, and it's important in all of these scenarios to make sure you talk with your doctor for individual advice on your circumstances. And we've also talked here today about Chinese medicine perspective and how acupuncture and herbal medicine can work together to treat endometriosis, and how a lot of times it's what we call blood stasis as part of the problem from a Chinese medicine perspective. It's important to look at all the organs, especially the liver and kidney and the Chong and the Ren meridians. So maybe you have endometriosis and you're listening to this podcast today because you're looking for treatment options for it, or somebody you know may be looking for treatment options. If so, I recommend considering acupuncture and Chinese herbal medicine. And if you or someone you know is interested into looking into Chinese medicine, visit our website for more information at www.houstonacupuncture.com, and you can get more information there. We would love to hear from you. And thank you for joining us on this episode of East Meets West.